Needlestick injury. General considerations. Learning objectives. The risk of transmission to common bloodborne viruses. The healthcare personnel who are at increased risk to needlestick injuries and the activities that put the personnel at risk. Definitions. The documentation needed following a needlestick injury. And preventive measures to reduce the chance of exposure. The risk of transmission. The risk of transmission associated with hepatitis B virus depends upon the hepatitis B E antigen or the envelope antigen. The hepatitis B E antigen is an indicator of active viral replication and increased infectivity. Therefore, the transmission risk if HBe antigen is positive is 30%, while if HBe antigen is negative, it is reduced to 1 to 6%. The risk of transmission associated with hepatitis C virus ranges from 1.8 to 3%, and with HIV is 0.3%. It is important to note that among the three common bloodborne viruses, hepatitis B virus is the most infectious, being almost 100 times greater than HIV. There is a higher risk of needlestick injuries among healthcare workers in India due to various reasons such as higher burden of bloodborne viruses in the country, poor adherence to standard precautions, including lack of awareness and implementation of standard precautions, inadequate availability of personal protective wear, and lack of sharp disposal containers. Poor injection practices, particularly in the busy areas of a hospital like casualty, ICUs, and operation theaters. Suboptimal documentation of occupational exposures. Poor knowledge about post-exposure prophylaxis among healthcare workers, and inadequate basic medical care. Other factors such as heavy patient load, stress, and fatigue of the healthcare worker also contribute to the risk. The healthcare personnel working in laboratories who are at risk of needlestick injury are laboratory technicians and housekeeping staff. Activities associated with increased risk are the following. The highest risk is seen with recapping of needles. It is to be noted that used needles should never be recapped. Other activities are disposal of needles, unattended needles, performing tasks barehanded due to unavailability of personal protective equipment or voluntarily not using personal protective equipment, and transport of patients. What is an exposure? An exposure can be any one of the following three instances. The first, a percutaneous injury with needle stick or being cut with a sharp object. The second, contact or splash of blood or body fluids onto mucous membranes or non-intact skin, that is, skin which is chapped or abraded or inflamed. And finally, prolonged contact with intact skin or contact that involves extensive areas of skin also amounts to an exposure. What is a needlestick injury? The World Health Organization defines needlestick injury as a penetrating stab wound from a needle or other sharp object that may result in exposure to blood or other body fluids. The factors that influence the transmission of blood-borne viruses following a needlestick injury are the depth of the injury, whether the penetrating needle stick was visibly contaminated with blood, whether the needle was directly inside an artery or vein, the type of needle, whether it was a hollow bore or a solid needle, the thickness of the needle, the viral load of the source, the quantity of blood or body fluid to which the healthcare worker was exposed, and the duration of exposure. It is critical to report and document an exposure. The documentation of an exposure must first contain details of the source, including the infective status. Next, the details of the exposure itself must be mentioned, such as the date and time of exposure, the nature of exposure, whether it was percutaneous, mucosal, non-intact skin, or over intact skin, the body site that was exposed, and the duration of exposure. For percutaneous injuries, a description of the injury itself, such as the depth of the wound and the nature of the needle, and the circumstances under which the exposure occurred. Finally, the documentation must include previous testing and immune status of the exposed healthcare worker. The cardinal rules of standard precautions should be kept in mind while working in a healthcare facility. Consider all patients and samples as potentially infectious. Assume all blood and body fluids and tissues to be contaminated with a blood-borne pathogen. Assume all unsterile or used needles and other sharps to be similarly contaminated with a blood-borne pathogen. A broad approach to prevention of transmission of blood-borne viruses include strict adherence to standard precautions, immunization of all staff against hepatitis B virus, provision of personal protective equipment, clear protocol for immediate management of any exposure, and healthcare practitioners with high viral loads to refrain from exposure-prone procedures. Details of preventive measures include strict compliance to standard work precautions, avoiding the use of injections where safe and alternative methods are available, to use a tourniquet instead of asking another person to hold the arm of a patient during phlebotomy, to avoid recapping needles. The needle should be separated from the syringe after use using a forceps or clamp. A plan for safe handling and disposal of needles after use must exist. Used needles must be promptly disposed at the point of generation into puncture-resistant disposable sharps containers. These sharps containers should never be completely filled nor filled above the line indicated on the box. All needlestick and sharp-related injuries must be promptly reported to ensure appropriate follow-up and care. Every ward, laboratory, and section must have a register to record and monitor injuries. All employed healthcare workers must be immunized against hepatitis B virus, and participation in training related to infection prevention and control. This brings us to the end of the session on general considerations of needlestick injury. Post-exposure prophylaxis and management of needlestick injury will be discussed in the next session. Thank you.